In the earliest human communities, illness had to make sense in the language people already had. Then seizures happened. A person could collapse without warning, stiffen, jerk, and lose awareness, as if their own body had turned against them. The episode ended, but the fear stayed. There was no wound to point to, no fever to explain it. Something invisible seemed to strike and vanish. People watched patterns and drew conclusions from what they could see. The suddenness felt like an attack. The strange movements looked like a struggle. The unconsciousness felt like absence. So the cause became a presence, a spirit, a curse, a force that entered and took control. When the person recovered, it seemed like the thing had left, at least for a while. That idea changed everything about how seizures were treated. Once seizures were framed as supernatural, the response became social as much as personal. Families searched for blame, enemies, broken rules, offended powers. Some people were protected, others were avoided because another fit could come at any moment. The goal was not to understand the brain. It was to deal with a threat no one could touch, and that pushed communities toward rituals meant to drive the unseen back out. After the terror of a seizure passed, the questions stayed. Why did the body jerk and stiffen, then go still as if nothing happened? Healers began offering a new answer that sounded practical, even if it still leaned on the unseen. Something did not just visit from the outside. Something got in and stayed in. The trouble, they decided, sat inside the head, trapped where it could not escape. That shift mattered. If the cause lived inside the skull, then the skull itself became part of the problem. The head was no longer only a place where spirits struck, it became a container. People began to imagine pressure building, a force pushing against bone, looking for a way out. And once the head sounded like a sealed vessel, the next idea followed naturally. A trapped thing needed an opening. So healing started to look less like pleading and more like release. Rituals still surrounded the sick, but the goal narrowed to one clear task. Let whatever was inside leave the head. The body's sudden violence seemed to support it, as if something fought to escape. And in that logic, the healer's job changed. It was no longer only to calm the spirits, it was to make a way out. Once the idea took hold that something inside the head caused the convulsions, the next step felt almost inevitable. If the problem was trapped, then a way out had to exist. So healers turned to the skull itself. They cut through scalp and began to scrape or drill into bone. It was not done as a clean medical procedure. It was done as a ritual act with a physical goal: open the head, release the force, stop the seizures. The method varied, but the aim stayed the same. Some used sharp stone and steady scraping, wearing a shallow pit into the skull little by little. Others rotated a tool to bore down. They tried not to pierce too deep, because beneath the bone sat the vulnerable tissue that meant life or death. Yet they kept going until an opening appeared. In their logic, that hole became a doorway. What tormented the person could finally escape. For the person suffering seizures, the stakes were immediate. A fit could strike without warning, and the community had no other way to predict or control it. Trepanation promised control, even if it carried huge risk. Blood loss, infection, shock, none of these were fully understood, but all were real. Still, the act persisted because it offered a simple cause and a decisive response. When seizures returned, the answer was not doubt. It was another attempt to open the head. Then something unexpected appeared in the evidence people left behind. Some ancient skulls carried neat openings from trepanation, but the bone edges looked rounded and reformed, not sharp and fresh. That mattered. Bone only changed like that in a living person. It meant the drilled or scraped hole did not always end in death. At least some patients lived long enough for their skulls to begin repairing itself. That healing changed the story in a powerful way. If a person survived a hole cut into the head, the act no longer looked like a one-time gamble or a final ritual. It started to look like something that could be done and lived through. A procedure, not just a ceremony. The survivors became proof. And proof, in a world without records, spread through memory and repeated practice. With that new belief came a new kind of confidence. Healers kept returning to the same idea. If the hole had been survived before, it could be survived again, and maybe it could be used on purpose to stop seizures. Trepanation started to repeat across different people and places, not because it always worked, but because it sometimes did not kill. Survival alone turned it into a treatment option. In the first cities and kingdoms, trepanation no longer looked like a one-off act of fear. It became a procedure people expected could be repeated. Practitioners kept sets of tools made for the job, scrapers, drills, and circular saw-like instruments, each one shaping the hole in a more controlled way. Roles hardened too. Some people became known specifically for cutting into the head. This was craft now, not just crisis. With that craft came routine. The skull got opened in familiar places, with familiar methods, and the aim shifted from simply releasing something evil to correcting something wrong. Seizures still terrified families, but explanations widened. Early medical ideas pointed to pressure, trapped fluids, or imbalances inside the head. A hole could vent what was building up. The same action kept its old meaning, yet gained a new one. That mix of reasons changed how the operation was defended. A trepanation no longer needed to stand only on ritual authority. It could be described as practical treatment. If a person survived and seizures eased, the result looked like proof of theory and skill. And if it failed, the blame could shift to the disease or to what had been missed inside the skull. Standard methods spread because they felt safer and because they seemed explainable. Over time, a different kind of explanation started to spread, especially in the classical world around the Mediterranean. Some writers and physicians stopped treating seizures as a message from the spirit world and started describing them as a disease of the body. Epilepsy no longer had to mean possession. It could mean something physical had gone wrong inside a person. That shift sounded simple. It threatened everything the drilling was supposed to accomplish. These authors watched patterns. Seizures could run in families. They could appear after illness, exhaustion, or injury. They could come and go without any ritual at all. So they argued that epilepsy followed natural rules, even if those rules were not fully understood yet. Once that idea took hold, trepanation faced a new question. If nothing supernatural was trapped in the skull, what exactly was the hole meant to release? The result was not an instant end to drilling. It was a clash of explanations. One side blamed spirits and demanded an opening for escape. The other side described a disorder and pushed for observation, diet changes, and bodily balance instead of a ritual cure. Patients and practitioners stood between those worlds. A seizure still looked frightening, but now, for the first time, a respected written tradition said it was nature, not invasion. In the medieval world, seizures still looked like a battle between a person and an unseen force. Many people kept spiritual explanations close, even as older natural ideas lingered in the background. Trepanation did not vanish. It stayed on the list of things a healer might attempt when a case seemed desperate, but it no longer stood alone. Other answers pressed in, and the choice of treatment started to split. For many families, the first response became prayer, blessings, and protective charms because they fit the fear that something evil had taken hold. These options felt safer than cutting bone, and they could be repeated again and again. At the same time, learned medicine pushed humoral remedies. Foods, purges, and bloodletting meant to rebalance the body. Each approach promised control. Each one also gave a reason to delay drilling. That competition changed what trepanation meant. It often became a last resort, used when prayers failed and humoral fixes did not stop the convulsions. The idea of trapped spirits still hovered over the decision, but it mixed with practical hopes about relieving pressure or removing a hidden cause. The medieval period did not settle the question of epilepsy. It multiplied the options, and uncertainty guided the knife. During the Renaissance, the body stopped being a mystery handled only by tradition. Anatomy advanced, and surgeons relied more on what hands and eyes could confirm. With that shift, trepanation began to change meaning. The hole in the skull no longer needed to be a doorway for spirits. It increasingly became a tool for a visible problem, damage after a blow, swelling beneath bone, and a head that seemed to trap dangerous pressure. Early modern surgeons dealt with wars, falls, and weapon injuries that cracked skulls and left people confused, unconscious, or violently ill. They learned that trapped blood could compress the brain and that pressure could kill even when the skin looked fine. Trepanation offered a direct response. By opening the bone, they could lift fragments, release pooled blood, and give the brain space. The goal shifted from cleansing to decompression. That practical logic changed how seizures fit into the picture. A convulsion after a head injury now looked less like possession and more like the brain reacting to trauma or pressure. Trepanation still appeared, but the reason sounded different. Not to let something evil out, but to remove what should not have been there, or to relieve what squeezed the brain. The same hole remained. The explanation moved toward mechanics. In the 1800s, the focus finally shifted from the skull to the brain itself. Doctors began linking seizures to the nervous system, not to something trapped inside the head. Hospitals collected case notes. Autopsies compared injured brains to symptoms seen in life. Then a new idea gained ground. Epilepsy was a disorder of brain function. It was not a curse that needed an exit. It was a process happening inside living tissue. In the 1900s, that process became visible. Machines recorded the brain's electrical signals, and seizures showed up as sudden bursts of abnormal activity. Cause met proof. With that proof came different treatment goals. Calm the electrical storm, prevent it from starting, and protect the patient without opening the skull. New anti-seizure drugs arrived and spread through everyday care. For many people, pills replaced procedures. The old logic for drilling collapsed. For those who still had uncontrolled seizures, surgery changed too. It was no longer about making a hole and hoping something escaped. Surgeons aimed at specific brain areas that triggered the electrical surges, guided by testing and careful mapping. Sometimes they removed a small section, sometimes they interrupted a pathway. Results varied, but the intent stayed clear. Treat epilepsy as a brain disorder with a physical source. Trepanation faded into history as a seizure cure. Today, the first step with epilepsy usually happened before any treatment at all. Doctors tried to catch what the brain actually did during a seizure. EEG recorded the brain's electrical signals through sensors placed on the scalp, turning a frightening event into a readable pattern. Some patterns pointed strongly to epilepsy. Others ruled it out. The goal shifted from guessing at spirits to measuring brain activity. Then imaging added another layer. CT and MRI showed the brain's structure and helped reveal causes that earlier generations never could have seen: scars, tumours, strokes, or malformations that could trigger seizures. Doctors used this information to sort seizures into types and locate where they started. That classification mattered because the right choice depended on it. Precision replaced blunt force. Treatment followed the same change in mindset. Modern anti-seizure medicines aimed to calm unstable electrical firing, and many people gained long-term control without surgery. When drugs failed, newer options still focused on the brain itself, carefully planned operations, implanted devices, or targeted stimulation. The contrast stayed stark. The earliest answer had been to open the skull to release an idea. Now care targeted a diagnosable disorder.